Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine chiropractor. I'm here with my lovely Erin, and I thought that this would be a good idea to ask a couple questions, actually more than a couple questions, about Erin's situation and why she came here. So Erin, thanks for doing this.
Oh, no problem.
And sharing your experience here. So the first question I have is, if you don't mind telling everyone, what brought you here? What was your issue that brought you here?
So it wasn't one issue in particular, it was a bunch of little ones. I just wanted to improve my overall wellness and well-being and health. So I wasn't moving the way I wanted to, I was, my balance wasn't great. I wasn't working out as hard as I could. I just wanted to really optimize my potential.
I see.
So.
Well, that's fair enough. That's a great example of you don't have to be necessarily in pain, but there were certain limitations that you were having that you were just thinking that you wanted to have an improvement on.
Absolutely.
Okay. So now, was there anything that it was preventing you from doing?
Just my own self. So I mean, I moved to the area, and then I had to investigate different chiropractors, and I finally found a keeper.
So what made you choose this office?
Well, I really like your approach, your total approach to wellness, and
how did you know about it? Because you haven't been here.
I highly recommend you check her Yelp reviews. They're excellent, and they're all truthful.
Though I'm not a big fan of Yelp, just for the record, but go ahead.
Dr. Shakib takes a very granular, approach to your wellness. Your first appointment is going to be just examining what you want to improve and what your goals are. And then she'll put you through some really cool and interesting tests that you've never experienced before.
Maybe we can demonstrate in a different video what that even was like. Maybe a little...
Yeah, totally.
Yeah.
I mean, there were these hand exercises that I was absolutely miserable at, and yeah, so it was a real interesting battery of tests I got put through, and you were really able to pinpoint my strengths, my weaknesses, and just opportunities for me to improve myself and my coordination. I mean, the coordination, full disclosure, still working on it. I'm a pretty clumsy person. So.
You are so cute. This woman is definitely highly energetic, to say the least. So Erin, did you have any fears about coming here?
Well, full disclosure, I had been to a chiropractor before, so I wasn't as apprehensive as, say, a brand spanking new patient. But let me just tell you, if you are a nervous Nelly, Dr. Shakib will definitely put you at ease.
So, Erin, what was so different since you've been to other chiropractors, or you had been to other chiropractors? What did you see that was so different about my practice and what I do?
Honestly, when I came in the door, you were super friendly, and you actually wanted to find out what was going on with me. You actually spent time. It wasn't just like, oh, my lower back hurts. Okay, let me adjust you. Crack, 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 out the door. You actually spend the time, okay, so your lower back is not the greatest. Maybe it's because, you don't have the best abs. Maybe we need to work on your abdominals. And then it's like, oh, hey, you fall up the stairs? That's interesting. We have a very interesting cure for that, too.
Because usually fall down the stairs, not up the stairs. So in other words, all postural you would tell me, I do remember this actually, that you tell me stories, and this is what happens with all my patients. You tell me your story, and I see what's hidden behind those words that are indications of what needs to be worked on. So at this point, let me tell you, what was so special about the practice? What did you look forward to each visit that you came?
Well, honestly, real talk, I am super obsessed with getting adjusted. I love getting adjusted. But what was really great was you custom, bespoke, tailored my whole physical therapy angle to actually target the areas of my brain that weren't sending all their messages down to their soldiers, because she has this really cool metaphor about the brain being the general and your muscles being soldiers.
The commander.
Yeah, the commander. So no, I mean, as much as I love getting adjusted in that lovely, like, I've just done 6 hours of yoga and I feel amazing, it was really learning all these just interesting, small, very targeted exercises to strengthen, well, my weaknesses, for lack of a better.
So we'll do another video to more explain what that was about. But thank you so much, Erin, for sharing your story with everyone. We in the practice, we look forward to seeing you and your lovely energy. And I do know that you chose, just for the record, that you did choose to go beyond what you initially came here for, and that was a choice you made. Did you at any point feel there was I was telling stuff that were not true, or I was trying to sell you something, or I was trying to push anything onto you?
Oh, no.
Did you have any of that experience?
No, I mean, I've had that experiences at other locations, but certainly Dr. Shakib's definitely not like that. And she definitely, I think one of our first meetings, she's like, I'm not here to fib you, to fool you. I'm here for you and working with you. So she
and I think she's probably kind of making it a little bit sound nicer. Because I think my general term is, I'm not here to be liked by you. I'm here to perform a task that you're hiring me to do. So we are on the right team, and communication is the key.
Exactly.
Did you feel at any point that you were heard, your issues?
I
your
always
concerns?
feel heard. I can come, okay, my left ear hurts, and you're like, cool, let's find out what's wrong with your left ear. Like, you definitely always adjust for whatever your patient's feeling at the time, and work on areas that, are patient directed, and, maybe that small patient directed problem, you can find a more pressing issue, like maybe your inner ear is acting up or something like that. So yeah, no, I never felt pressured. I always felt like the treatments were targeted, specific, and you were always listening to me and addressing my needs.
Well, thank you so much. Would you say that from your experience, would you recommend this practice and my style of chiropractic with brain-based neurology and posture?
Actually, because the huge little science nerd in me, I would recommend your practice to anyone.
Well, thank
far
you
and wide.
So much.
Far and wide.
Thank you, Erin, so much for sharing this, and thanks for watching. Bye.
Come see Dr. Shakib.